Good evening. Welcome to this month's Town Administrators Report. I'm David Watts Jr., and with me is our Town Administrator, Steve Mayo. Welcome, Steve.
Thank you, David. Welcome to you. Summer is over. It's pretty much over, I guess.
It's autumn.
We're back to wearing suits again, which is too bad, too. But nice to be here. Thank you.
And it's actually fall-like outside today.
Yeah, today it is. Well, getting a little warmer this afternoon, but that's good.
Joining us for the second of three programs in a row is Doug Lyons, our Superintendent of Schools. Welcome, Doug.
Good afternoon. Thank you for having me.
And as we tape this, we're one day before school comes back into session.
Correct.
Give us a little idea of where the plan is now a month later.
So the plan that was accepted, the reopening plan that was accepted by school committee is in phases, similar to the reopening of the economy and the phased opening that the governor created, the plan there. But on the school reopening side, what we're doing is phase one was 10 days of professional development, of which today was the last day. Mm-hmm. And tomorrow starts phase two, where we're starting the majority of our students in a remote model. So we're working early to make sure that all of our students have computers, all of them have access to the internet and can access the curriculum. And so that's a starting point for the majority of our students. And what we're doing is we're inviting small groups of students in for screening and orientation and to get to know them who are new to our schools. So students in kindergarten, pre-K, grade 5 at the middle school, and grade 9 at the high school. And as we work into next week, what we'll do is invite students in small groups still for safety reasons, for safety precautions, in other grades as well.
And, you know, when you say screening, is this health screening or is this academic screening?
No, normally at the end of the year, we do a kindergarten screening for students that are new to our district, newly coming to kindergarten. And some of them come from Doyle, and some of them come from other early childhood programs. And so what we do, it gives us an opportunity, and parents an opportunity to meet us, but it also gives us an opportunity to kind of meet with students and to learn a little bit about them and who they are as young learners. And how we think how best to group them mm-hmm. and schedule them and support them as they transition to the Wakefield Public Schools.
And how have, you were talking about remote learning, is there 100% coverage on machines for remote learners in the school system?
So we did a survey of parents, and we've learned that everyone has access to a computer. And there were a small number of families and students that did not have access to a computer, and we've provided one for them. And so we have kind of done a lot in building our technology infrastructure to make sure that all students have machines. So the short answer, David, is yes. We all students will have a machine and access to a machine, and also access to the internet. And
of course, the most important thing, work has been going on in the different schools, and I've seen it going on at Greenwood down the street from me, to work on the classrooms so that they're safer. What has been done to ensure the health of staff, teachers, and students in the schools?
That's a great question. And so the same safety precautions that are being practiced in other parts of our lives, you know, hand hygiene, social distancing, mask wearing, you know, not gathering in large groups, right? Being attentive to your, you know, where you're traveling, mm-hmm. And thinking about what transmissions looks like in different communities. When transmission is higher in different communities, sometimes you want to be thoughtful about your travel, either in-state or out of state. So we're doing a lot to just kind of make sure that we're taking those types of precautions. But in school, what we're doing is we're making sure that that all of our desks for students are 6 feet apart. Mm-hmm. And we're giving students individual learning kits, so they won't be sharing materials like they have in the past. So, and that will kind of limit, you know, who's handling what.
Right.
And so students will have their individual learning kits. They'll all have their individual machines, and their desks will be 6 feet apart. And we have passed a policy for face coverings, and all of our students pre-K through post will be required to wear masks as well,
Full-time.
full-time. So there'll be breaks. We'll be able to get mask breaks during the day. That's going to be a big part of what we do. A lot of our students, we had a summer program with close to 50 students, and they were elementary students. They did a great job. We didn't have any concerns with our students wearing masks. They came in during the day and they had mask breaks, they had snack, and they managed really well. And so did our faculty, which is one of the things that is making us so optimistic about welcoming students back and opening here in the fall, right? It's because we've done it once successfully.
I think that's an important point, that did happen. The summer school program, I think it was Woodville, right? It happened at Woodville, and I talked to the superintendent a lot, and we were anxious about what's going to happen. Are we going to see a spike and what have you? And we didn't. That doesn't mean that we're perfect.
Right.
But it does mean that the protocols that we took, and that the people and the students and the parents and the teachers bought into it, and made sure that they all were safe. So I think that bodes well. Let's put it that way. Bodes well.
Now, most of the schools, you and I were talking about this the other day, most of the schools have active HVAC,
Yes.
heating, ventilation, air conditioning systems in them now.
Right.
Greenwood, of course, is the one that doesn't, as much due to age as anything else. And a little over a year ago, an air quality assessment was made at Greenwood that did point out some very serious problems, one of which has been taken care of, which is the roof. But others elevated CO2, for instance, carbon dioxide, which is not good. Carbon monoxide was virtually zero except for in the cooking area. There were, I believe, 24 recommendations made. One, as I say, the roof has been done, the ramp has been done. What else is being done to make that school as up to standard with air quality as the other schools who have HVAC currently?
So one of the things that we've done is we have commissioned a full HVAC assessment of all of our buildings, including the Greenwood. So the report that you're referring to that was done over a year ago at the Greenwood, we've looked at that report and the recommendations that were made in that report. There was nothing in that report that stated that the building was dangerous or unsafe, or that it needed to be closed, or that immediate corrective action needed to happen. Just to be, and the reason I make note of that is because elevated CO2 levels are not acceptable. We're not kind of resting on our laurels and just saying that those are fine. That's not it at all. But in regard to every recommendation in that report, I think that there were 24. And our facilities manager, Bob Shiroli, along with Joe Conway at DPW, Steve and I have gone through all of those recommendations, and we've done, I think, everything that we can do, with the exception of installing an HVAC system, a new system into the school, which, to do that is not, it would be cost prohibitive, right? And so we're balancing safety with what's really prudent, right? And in terms of just really doing the best we can in managing that property.
And I think a big part of that report, because I've read it 2 years ago now, or a year and a half ago, and read it recently, we talked about the other day, is airflow and getting more airflow in.
Right.
And a lot of that is circulation, opening up windows, providing fans and what have you. And
Right.
I got to say that our DPW director and the Joe Conway and the director of facilities and grounds, or whatever you call them at the school department, they work very well together, and
Yeah,
have been
I would
working
agree.
very well together this whole, since forever.
Yeah.
And have really worked well in pointing at those issues and making sure that happens. So I'm pretty confident that that's going to be fine. Superintendent hit right on the head. The building was not deemed dangerous. There was some elevated levels in some area, whatever that means, but well below what standards would be for OSHA or anything like that. So these will be taken care of. And
So I think one of the things that's important to note is that as we look at CO2 levels now,
right.
right? With as we've kind of opened windows and gotten fresh air into the buildings, and our CO2 levels at the building now are below 600,
Yeah.
right? And which is fantastic,
Yeah.
right? It's and we're working very closely, like Steve said, to work to find solutions,
Right.
both with air purification and also with fans to increase the exhaust of air from rooms. And really working to make sure that we're doing everything that we can do to keep an airflow through that building.
Right.
And the beauty of that building, and it's a spectacular building, and the beauty of that building is that it has more natural ventilation than any other building that we have online right now, maybe with the exception of Hurd.
Right.
Right?
Right,
I
yeah.
mean, yeah.
We're still hanging on to the herd.
Yeah, no, that's great. Yeah, but
Well, a couple of buildings actually, Hurd and in Greenwood.
Ewell.
Ewell.
Ewell, yeah.
Yep. But, which is also an interesting case, because that's now being rented by another school that's in
Correct.
full session. It'll be interesting to see what happens with that school. In the reading I've done since our last show, more and more the thing that comes up is the value of HVAC with high-quality HEPA filters, which is something, obviously, we can't do in a school like Greenwood. I'm not sure if we can even do it in a school with some of the older HVACs like Doyle or,
Well, in reading, we've, superintendent has been great about ordering a number of independent analysis,
Yeah.
independent reports on these buildings. And most of the buildings do, they do have a system with different levels of air handling systems. And a lot of it depends on what type of filter you put in there. I've learned a lot about, what is it, a MERV 8 versus a MERV 14?
Yes.
Things that I don't
Yes.
really.
we're learning a lot about science.
About science.
Yeah.
And, change the filters more often, upgrade the filters where you can. Make sure that we run the systems, before,
Right,
earlier in the day,
Right.
To get it moving, and later in the day. I mean, we'll end up probably running systems with some ventilation open, windows open. So all those things your mother told you, close the window while the heat is on. No,
Yeah.
it's gonna be counterintuitive. So, but I think the changing the filters, and I gotta say that, again, working together, the town side and the school side, I think they've greased every belt. They've opened up every vent. I don't think there's one that's not working right now in the school system.
Right.
Correct me if I'm wrong. I think there were a couple, and I think they knocked them off this week.
I did.
or
We're
last week.
adding, right. I think we've done, we're adding screens. We've gone through every filter, and we've put in the highest quality filter that the units can take,
Right.
both on our rooftop units and also our unit vents. And so, so I think that we've done a lot of work on the front side in the last 6 months. So this didn't start in the last 4
Right.
weeks. I would argue this started back in April.
Yeah.
And I think, I think we're one of a few towns, correct me if I'm off, Steve, that has an HVAC tech working
Yeah.
for the town.
That is a huge benefit to us. We have two, actually. They're pretty overworked right now, but that's okay. But I'm hearing from my colleagues out there that they can't get anybody out. They
Right.
can't get anybody out to work on it. So we've had our exclusive pair and others that they brought in working together, working on all these. So it has worked out very well.
right. But then what's the contingency for the winter? Because in a school like Greenwood, with no HVAC, opening the windows in January isn't exactly a practical solution to
Well,
maintaining airflow to keep everyone safe.
Yeah, and so if we go back a minute, you asked what were we doing, what do classrooms look like?
Yeah,
So classrooms are kind of, they're looking empty. They're looking like bare bones. There are student desks, teacher desks, and there's not a lot of things in those classes that were in years past. We've moved all of that out into storage containers, right, by design. And with, and the things that generate CO2 are our students, right? And so that's why we need to do a full testing of a building. Students need to be, and adults need to be in the building, right? And so, we can do a baseline now and report really low numbers, but the buildings are vacant, right? But one of the things that's going to bring the levels down at a school like Greenwood and at all of our schools is in our hybrid model, which we plan on going into in phase 3,
Yep.
the enrollment, the number of students in the building at any one time is cut in half, right? So if you have 250 students enrolled at Greenwood, 242, you're looking at 120 students minus the students that are going full remote. So you're probably looking at 100 students in 10 classrooms, right? That are 6 feet apart. And so, and we think, to keep a window cracked or to keep a few windows cracked, and if we need to turn the heat up a little bit and it costs a little bit more for energy for us to do that, to keep students safe during this time and teachers safe, of course, we will do that, right? The other part that you brought up, which is important, and I can see you've done your research here. I'm just looking at your
Just a little bit.
Yeah.
That's only about a tenth.
Yeah. The other piece that's important, you asked about a HEPA filter.
Yeah.
Right? And Steve started to allude to this, is that we're looking at air purification devices that have HEPA filters in them, right?
Yeah.
Which at a micron level can capture pathogens or trap pathogens that carry the coronavirus. So we're open to, and we're looking at every possible thing we can do to keep students and adults safe in these buildings.
Yeah, I know my barber in Greenwood has installed in her shop a device that's an ion HEPA filter type. And for a small space like that, it's fine. This thing would have to be huge for a classroom.
They're bigger. Yeah, they are bigger.
Yeah. But, that might be one technology that might be possible as time goes on.
Yeah.
I don't know. I don't know how big they've scaled them yet.
Well, I mean, the modular units are based on square footage.
Yeah.
And the devices that we're buying will cover the square footage of the school. So we feel, and we have, we're treating Greenwood differently than other buildings because it's an older building. And we know that we need to kind of make adjustments there and adapt differently than we would at Galvin, which is a brand-new school, right? So that's what we're doing.
Yeah, Galvin has a more up-to-date
brand new.
HVAC.
Brand new system.
Yeah.
Walton was redone when we redid Walton.
Woodville.
and Dolbear
Yeah.
Are the same
fairly new.
generation that have complete
Yeah.
new systems, right?
Yeah.
Yeah. And the older systems would be the high school, obviously, which dates back to the
50s.
mid-70s.
72.
Yeah, well, 77, 76 when they built the
When they built
surrounding.
the surrounding, yeah.
Yeah, and then you go back to the original.
52.
You go back to the original core of the building, which was the junior high, which was the late 50s. So, the other aspects, of course, are curriculum. Obviously, whatever solution is found is making it more difficult, both for students and teachers. How is the school department going to maintain the same standard of learning that existed before COVID-19 in this hybrid system? How is it possible, or is it even possible?
Well, I mean, standards of engagement haven't changed. Standards of expectation, I don't think have changed. I think one of the things that's a positive for us, I think teachers are really eager to get kids back in any way that they can come. I think that energy is going to be really positive at engaging students. But students have missed. They've been away from in-person instruction for 61 school days last spring, and we haven't been back in session for 6 months now.
Right.
So there are going to be adjustments that we need to make. We need to meet students and families where they are, and whatever remote learning has been like for them this past spring, and kind of bring them on board and work to get them caught up. In the hybrid model, it's an abbreviated schedule, so the in-person instruction is shorter than the regularly scheduled day. So that's going to be a challenge for us. We are going to be asking students to do more remotely, and that's going to be a change for families and students, because we're going to be doing it a little bit differently than we did this past spring.
How so?
Well, this past spring, we gave students credit for the work they did, and this spring, or this fall, excuse me, this fall, we're actually building in assessments and grades. Assessments, grades, and testing is going to be a different standard and expectation than they were this past spring. We really felt like that, students and families were struggling with, life-threatening illnesses and all sorts of situations where they were managing extended family. But now that, we have, I think, more experience with remote instruction, we really feel like we have to take advantage of the time and try to ask more of our students, but also try to support them differently as well. So it's not going to be the same, like a one-for-one, and there's no magic wand here to kind of get students caught up. One of the things that Steve and I have talked about is kind of an 18 to 36 month look at really thinking about trying to get back on track with the budget, get back on track, in terms of where we are and building our schools and what we're offering and how we're supporting students. It's going to take some time.
Yeah. I think what's important to note is that when the schools were essentially shut down in March, okay, that was, guess what? You're not opening on Monday. You're
Right.
going full remote, and with a lot of those early decisions from the state, or more than guidance, directives from the state, let's say, it was very quick. It was very short notice and what have you. Luckily, really credit to the school committee and the superintendent, Wakefield had a remote, I'm going to call it a remote package for lack of a better word, but they were up on remote learning. Some communities around us basically didn't have that, had to scramble to pull something together, and it was weeks of, really no instruction.
Right.
So that never happened here. So that's a real credit to the Wakefield School Department and to Doug. And I remember in the early days when that, Learn Anywhere system was going in, and it had to be approved by the Commissioner of Education, and that was a kind of nip and tuck, but it did come in, and thank God that we had it. So that's very impressive, and I think that the program now, when you look at it, that it is a little bit abbreviated because of the circumstances, but it does hit the subjects. And there are assessments in there, and I've read the package that the superintendent has put forward and school committee approved, and it really is showing that learning is going on. And is it ideal? No, it's not ideal, because we'd much rather all be back. We'd much rather be back to full capacity everywhere. But this is a great move forward. The other thing that's interesting, and Doug and I have talked about this, is that for a certain segment of the population, for certain students, and I've talked with teachers about that, have said, some kids are actually thriving on some of this. That kids that had maybe a little problem, the classroom was too busy, too confusing,
Right.
in front of their computer, they're doing a little bit better. And other kids are, so there's going to be a learning curve, education learning curve, right, for all of these students to kind of get back in there. So I think we can look at that as a real potential about how we change instruction going forward. So I think that there's a lot of that going on, and I give all the credit in the world to Doug and his team, because it's a very thoughtful, far-reaching plan. And we look forward to supporting them and implementing it.
Well, but it also brings up another question, which, if there is a student, for whatever reason, that has to do full remote,
Yeah.
okay, cannot in any way participate in class, how will he or she be ensured of parity of learning with those who are doing the hybrid?
That's a great question, and I think a lot of districts are struggling with that question. I think one of the biggest challenges for districts, for superintendents and administrative teams and reopening teams is, when you have a cohort of students that are going full remote. Here in Wakefield, we have a little over 300 students. About 9 to 11% of our student population are choosing the full remote option. So what some districts have done is they have chosen to purchase learning management systems. So for example, if you're in grade 3, you can purchase a virtual seat, and a learning management program that you can kind of sit at your computer and it will provide instruction. It will provide the subjects that you need. You'll step through it. There's not necessarily a lot of teacher interaction there. You don't need a teacher to supervise the plan. You need an adult to supervise the plan, right? And sometimes, parents that homeschool, if there's a difficult subject that they have, that they want their child to learn or a child has an interest in, they've accessed bits and pieces of this. But the scale that some districts are bringing this on, they're bringing it on, full-fledged for all core areas, right? And we had a choice and an opportunity to do that, and we didn't think that would quite be the best fit for us. So we're looking at kind of staffing, right? Having our teachers manage remote cohorts, right? And so it's an expense, but we feel like the advantage is what it does is it keeps our students close to us, close to our system, close to the curriculum, and it also gives us really the best opportunity to keep students socially and academically connected, not only to the schools, the teacher, and the curriculums, but also their peers.
Right.
Right? And so when we start remote in phase 2, everyone's starting together, right? So if the 3 of us were starting phase 2 tomorrow, and we were all high school seniors, we might all be in the same math class together. When we go to phase 3 on September 29th, if I were going full remote, I might cycle out and spend time with another teacher. You might come in on Monday, Tuesday, or Thursday, Friday for in-person instruction, where I would be getting instruction via remote
Strictly on the
instruction.
computer.
Yeah.
Right, but you would have it with other classmates that maybe are.
You would be with other students
Right.
that chose
So
the
you-
remote option
So
as well.
you'd have that. You'd
So-
have that
Right.
camaraderie,
Yeah.
as computeristic as it is, but you would have that, so.
Because one of the important things about school is the social
Right.
interaction. That's where kids learn to be, for lack of a better term, human beings.
Yeah.
And deal with each other and all of the things that go with that.
And I think that's a better way to do it. And it also
You know.
allows a transition, God forbid, if we had to go to full remote again because
Right.
of what happened, that
Right.
you already have that going, you're just switching
Right.
back to it, so.
But what does that do for the teachers? The teachers have, a hard enough job as it is normally. Now with all of these requirements, what is that doing to the teachers and what is expected of them?
So it depends. So the schedules are different at preschool than they are at elementary, different than they are at middle school, and different than they are at high school. Right? Every level has a kind of a certain complexity that differentiates it from the other levels, right? And so, excuse me. So what this does is, so if I'm a teacher at elementary, my remote kind of commitments are lessened because we know students need to be in person more. So the hybrid schedule that we've created for phase 3 brings students in a morning cohort
Right.
and then again in an afternoon cohort. So it's, if you think about the conversation or comment I made a moment ago about cutting the populations or the enrollment of a school in half, you can, cut it vertically or horizontally, right? And so by splitting the day, it increases the frequency that we're seeing children, but it also decreases the need for them to be in front of a screen. Whereas in middle school, we can ask for a little bit more screen time. They're a little bit more mature. And in high school, we can even ask for more screen time.
Right.
So the high school model for hybrid is we're coming in, middle school and high school is coming in on Monday, Tuesday, or Thursday, Friday. We're using Wednesday and Saturday for kind of deep cleaning of our buildings. But those are some differences that I think will engage students, but will also also support really students in a positive way.
Right.
So, yeah.
But I'm also thinking about teachers now, because they have certain requirements they have to meet as teachers day to day. Is
So-
this increasing the requirements on our teachers, or is it somehow balancing out?
So it is. I would say it's increasing, but it's it's increasing because it's different, right? And so the expectations are, all of our jobs have changed, right? We're seeking the same outcomes, but the inputs are different, right? And so we're seeking kind of high levels of achievement. We're seeking to assess students. We're seeking to engage students, but we're kind of changing our access to students. So even though traditionally the contract states, a teacher will teach so many periods. So even though we are kind of meeting the contractual parts that you might think, well, they're equal, they're not equal, because they're taking on a whole new job, a whole new way, which is really difficult, and at the heart of this, and this goes back to comments that Steve made about our Wakefield and the Wakefield Public Schools' ability to provide remote instruction at a really high level and provide hybrid instruction. This is really, our ability to do this well is really all about our teaching faculty, right? Their ability to learn new technology, their ability to adapt to different schedule formats, different groups of students, different access to students. So they've been open to all of this. And we couldn't reopen schools if they weren't so open and able to kind of shift and pivot and do this so well. So a lot of the credit really belongs with them. So, and I think if you were to ask any one of them, if given a choice, in person or remote, they would say, give us in person every day, all day.
Yeah. Oh,
Yeah.
absolutely.
Yeah.
Absolutely. But, and another component of that, and I've been a critic of it for many, many years, is MCAS.
Yep.
Where does that figure into this new way of teaching?
I think you asked about this in our first meeting, and so
But things change week to week, so I'm asking it again for a reason.
So I bring this up because I think my answer is still similar in that MCAS, in terms of accountability, a check and balance, where students take an assessment to give the state and the federal government feedback in terms of metrics of how students are achieving, right? That part of the Mass General Law and the federal Department of Education law is a requirement that came with No Child Left Behind, that's been in place now for going on 25 years.
20 years.
Yeah.
George W. Yeah.
So the origins of, No Child Left Behind were in place before the inception of the test. So, but we're talking the same talk.
Yeah.
Yes. Yeah.
So
I think-
MCAS is still a requirement.
Still a requirement.
Bottom line is we're ready to start tomorrow.
Bingo. Yeah.
Okay, but the one last thing that I want to make sure we cover, because this is the one that's key to whatever plan is in place. If this doesn't work, that plan goes out the window. How are we going to monitor the health of staff, teachers, and students across the school system so that we know from day to day, can we still continue this plan? Is there a protocol in place that is going to monitor this and keep people informed, especially parents, especially teachers, and a lot of those teachers, I would assume, don't even live in Wakefield. How are we going to monitor the health situation of all of these people in the school system in Wakefield?
Well, I'll jump in on the Board of Health side.
Yeah.
I mean, so, the reporting mechanism for COVID and COVID-related illnesses is
Yeah.
very robust, okay? And we have done a really, Ruth Clay and her team has done a fabulous job of following up on contact tracing and what have you. So we will be looking at a metrics, okay? I mean, you look at communities around us that maybe jumped, and I hate to use the colors because a lot of things, it doesn't
Well,
tell
there
the
are a
whole
lot of
story
things in those
there,
that make
if-
the colors kind of ambiguous,
But
yeah.
if we started to jump we jumped to red because of something, then the school department and superintendent is nimble enough that they will have to pivot to some other form of instruction.
Right.
If that happens. So I think that is the plan, as I noticed, that this is monitored daily, weekly, what's going on. There's a lot of communication between the school nurses.
But that's within the town of Wakefield. We have
That's within the town of
staff and
Wakefield.
teachers, we have
will-
employees that
right.
don't live in
Well, we will
Wakefield.
also know if those employees are sick as well.
Is there going to
Yeah,
be
absolutely.
comprehensive, regular
Absolutely.
testing of employees in the system?
So we cannot, at this point, mandate
Testing,
comprehensive, regular testing,
Mm-hmm.
right? And so, we've been asked this question several
Mm.
times. Can we mandate testing? And we cannot do that, right? And so, no one in the state can do that.
Right.
No one is prepared to do that at the public school level, right? Yet, right? And I say yet because I think as testing becomes more available, different systems are going to try to work out ways to try to provide access to testing, right? What Steve said is really important, and kind of doing work with our school nurses, right? We have two exceptional school nurse leaders, Mary Doherty and Kelly Quayle, that led 450 of our faculty and staff yesterday morning in kind of COVID scenario protocol training, right? And how do we do kind of daily check-ins? How do we make sure that we're doing everything we can do for safety precautions? But they also, a big part of this training really talked about transmission, right? How are we paying attention to transmission, right? When we talk about contact tracing, the interest in contact tracing is to really drill down on transmission and to understand, right, how to kind of flatten that curve, right? And so to limit the exposure of other people, right? And so, so Steve is, not talking a lot about what's happening with Board of Health, but I think you could, in that I think daily the Board of Health, Ruth Clay and her staff, this is
They follow up on every case. Every single case.
every case and every single contact
Right.
Right.
that is also reported. So, when you think of this as like a tree, right? And so, a name, a person, so when they do contact tracing, so one of the things that we are doing that we're paying very close attention to is symptomatic students and adults, right, as a starting point, right? If anyone is symptomatic, right, we're going to do a daily screener. And if anything comes up on the daily screener, we're going to seek that person out to understand what's happening with them, right? The other part of this is really contact tracing and understand, what school transmission or community transmission could look like. And what do we do? What do we do if we have one case in one class? What is contact with an individual person who's symptomatic or who tests positive? What is our response to that? And there's a very detailed response that Board of Health and our nurses are all on the same page about, right? And so, but it's also tracking the number of cases, right? So I know I sound a little technical right now, but our nurses and the Board of Health, this has become, I would argue, a big part of their day.
Oh, absolutely.
I think
Yeah.
Ruth Clay is accessible 14, 15, 16 hours a day.
Oh, yeah, absolutely.
Yeah.
Yeah.
And that will happen.
She's
is that
always
they'll-
been very good.
There'll be that tree will go out,
Yeah.
Where did that student or staff get in touch with? And there may be isolation, there may be, quarantine.
Yeah.
I think we're seeing that happen in some other schools right now. Like, one student came in that, a few days later ended up having it, or the next day ended up
Right.
being diagnosed with it.
Well, there are
And all of a
towns that
sudden-
are starting to see blooms because
Right.
of things that have happened within the town or within the city that caused a bloom,
Correct.
And a couple of school systems have already had to change their plans.
And I think the message is, just because Wakefield has done relatively well, and recently, we've had some dark days with this too. And just because students are back in the classroom, that doesn't mean we all let down our guard. It doesn't mean that we don't wear the masks anymore. It doesn't
Right.
mean that we don't socially distance. It doesn't mean that we have a party, with 200 of our closest friends as much as we'd like to, right? So I think that, my message to community is that we got to keep strong, keep up the vigil, and, go very gingerly, do all those
Right.
things. Wash your hands, socially distance, wear your mask. I think that's a great rule, having all students and faculty wear masks. It's going to be, and it's a challenge. This is going to be a challenge, and I think superintendent and Board of Health and the teachers and the whole staff is up for it, so.
So lastly, and because we'll revisit this in Program 3 next month, which we'll have a couple of weeks under our belt to see where we're at.
Yep.
Right now, we're dealing with Plan A. This is what's happening. It's starting tomorrow, the 17th. We're taping this on September 16th, just so everyone has a reference. 4 weeks from now, when we do the next show, if there is a problem being tracked, what's Plan B? Is it full remote? Is it back to what we did last spring? What's Plan B?
Well, there's Plan B1, Plan B2, Plan B3, and I mean that in all sincerity, in that, if we have to pivot, and so, for example, what I mean by Plan B1, Plan B2, if we need to quarantine a class, we will. If we need to quarantine more than one class, we will. If we need to close a school, we will. If we need to pivot and have the district return to a full remote option for a given period of time, we will do that as well, right? And so those are our options, right? And we also know that as what transpired last year, the governor too has the power to say, we're going to close all of our schools until further notice. And so we're not anticipating that that's going to happen. We feel like with what we've learned about safety precautions and how to keep people safe and contact tracing, we feel like our Plan A is a heck of a good start. Yeah.
I
Okay.
agree.
Well, we'll leave it at that for this show. We'll come back and we'll see how we're doing 4 weeks from now,
Great.
which is I think going to be interesting for everyone. But also it will give us, right now everything is theory. Until after tomorrow, everything is theory.
Yep.
So, let's see where we're at when we come together again in October. And, hopefully things will be better. Thank you very much, Doug.
Thank you.
Thank you for having me.
Thank you.
Thank you, Steve.
For having
And
us.
thank you for watching us. We'll see you next month.